In order for you to lose weight and keep it off, there are 3 things you need to do. Number 1, eat and drink fewer calories. Number 2, be more physically active. Number 3, for best results, you should do a combination of both. Use this chart to help you set your daily target calorie goal. Here's how it works. First, find your current weight in the left column. Then, you'll find your daily target calorie goal for that weight range listed in the right column. On the lower end of this calorie range, you are likely to lose 2 pounds per week. On the upper end of this range, expect to lose a half a pound per week. Either way, you never want to be hungry. Choose the value that's right for you. Be sure to log everything you eat and drink. That way, you can keep up with the calories you take in. You're going to lose weight. So, once you make it to the next lower weight range, you will need to reduce your daily calories to that lower level. For example, let's pretend you start off at 280 pounds and you drop down to 245 pounds and you still have some weight to lose. Instead of eating 2,000 to 2,500 calories per day, you'll decrease this to 1,800 to 2,000 to help manage your weight loss. If you weigh over 350 pounds or you have any concerns, ask for a consultation with the Move Team dietitian to help set your daily calorie goal. Finally, review your food and activity diary as you continue to enter foods and beverages on a daily basis. Think about what got in the way and come up with a plan to eliminate those barriers.
Hi, my name is Carrie. I'm a registered dietitian at the Iowa City VA Lifestyle Medicine Clinic. Today for our Healthy Teaching Kitchen, we'll be making a zucchini noodle dish with spring green peanut sauce. This dish will delight your senses with bright spring flavors, yet provide a hearty and comforting meal for lunch or dinner. So clear your counter, wash your hands, and let's get cooking. So for this recipe, you're going to need 4 to 5 medium zucchinis. I've already made a couple of them into noodles, which I'll show you how to do in a second. You'll need a tablespoon of olive oil, 3 cups of spinach, washed or rinsed, 1/3 cup of natural peanut butter, 1/2 cup of white beans. I'm using a Great Northern bean, but you could do a white kidney bean, you could do a garbanzo bean. You'll also need for the sauce some tamari, which is a gluten-free soy sauce, apple cider vinegar, or rice vinegar would be fine, maple syrup, some water, and then some cayenne pepper and ginger. For toppings, I like to use either green onion or cilantro, and also to add some more bright colors, I'll put in some red bell peppers or some grated carrots. So let's go ahead and start by making our zoodles. So there's a couple ways that you can make zoodles, and zoodles are basically zucchini that's turned into a noodle. Noodles can be high in carbohydrate, so people watching their blood sugar would probably like this option of turning zucchini, which is very low in carbohydrate, into a noodle. So to do that, there are things called spiralizers. I have a very inexpensive spiralizer that actually works like a pencil sharpener. And how you use this one is you just go ahead and you chop off the end of the zucchinis. And then you just insert the zucchini into the spiralizer and you just turn it. And you'll start to see noodles come out. It's pretty awesome. You can buy these pre-made at the store, but they're fairly more expensive when you buy them already zoodled. So if you have an inexpensive spiralizer like this, you'll save a lot of money. Another way you can do it if you don't have a spiralizer, and some people prefer this, is you can use a vegetable peeler. And so all you do for that is you take a standard vegetable peeler and you start by just peeling. And so what this is going to do is provide some linguine-shaped noodles. And so you would just continue to do this until you get to the center of your zucchini where the seeds are, and then you can just discard the seeds and discard the center. So it does take a little more time to do the vegetable peeler, but it's actually fairly enjoyable, and I love these thick linguine-like noodles. So just a couple ways to spiralize. The great thing about zucchini noodles is you don't need to get out an extra pot and colander to boil the noodles and rinse the noodles. All you need to do is just turn on your stovetop, and you can put it on about medium and add some olive oil to a pan. And then go ahead and just add your zucchini noodles. And you're just going to let this cook for 2 to 3 minutes. It really doesn't take any time. So it's a nice quick meal. We are going to make a spring green peanut sauce, but this goes really well with a marinara sauce. There's all kinds of different sauces that you could use to top your zucchini noodles. Okay. So next let's go ahead and make the sauce. And so for this you'll need a blender. You could also use a food processor. And we're just going to start by adding the ingredients in the order that the recipe lists them. So the first thing is the white beans. This and the peanut butter is going to add some really healthy protein to the sauce. So you don't necessarily have to add chicken or shrimp, but you could if you wanted to the top of this. But for the sauce, we're going to add the white beans. We're going to add a 1/3 cup of natural peanut butter. And when I use natural peanut butter, I'm referring to peanut butter that doesn't have any added sugar and doesn't have any hydrogenated oil, because hydrogenated oil is considered a trans fat, which is inflammatory, and foods that are inflammatory can contribute to various chronic diseases, so we want to try to limit that. I'm also going to add 2 tablespoons of tamari. So tamari is a gluten-free soy sauce. It adds a nice savory taste to it. You could use soy sauce if you don't avoid gluten, but just make sure you buy a low sodium tamari or a low sodium soy sauce, because they are fairly high in sodium. This is apple cider vinegar. It adds a nice tang to the sauce, but you could also use rice vinegar for that as well. And then we have maple syrup. Just adds a little bit of sweetness. So we get about 4 servings from this recipe, and so you'll really only be getting about 1/2 teaspoon of added sugar when this is divided into servings, and that gives it a nice flavor. We're also going to add some ginger. And so fresh ginger is one of my favorite spices. It's actually a rhizome, and it has just a really, really warming smell, and it can add a bit of sweetness and spice to your meal. One of the things that ginger is best known for is to help with indigestion or nausea. So if you buy some ginger root, you can shave off pieces and put it in a smoothie. You could shave off some pieces and put it in boiling hot water and let it seep as a tea and then drink that. And then I love grating it up or kind of chopping it up and sauteing it with other vegetables that I turn into a chicken soup, like a chicken vegetable soup. It's very good with broth. And then finally, stir fries. You can grate in some ginger for a stir fry, and it adds a delightful flavor. So we're going to use about 1 inch, which is about a tablespoon of ginger. I'm just going to start by peeling off, I'll move some of these things, by peeling off that brown peel, just a little bit. It's very easy. You just have a paring knife, and then I'll just cut off about 1 inch, which is about a tablespoon, I would say. And then since we're putting it in a blender, I don't have to worry about cutting it up into really small pieces. That's what makes this so nice. I'm also going to add a 1/4 teaspoon of cayenne pepper. So I'll just do that. And definitely add more hot sauce if you love heat in your food. I've put sriracha sauce in before, and I loved that. So go ahead and add more if you like things with a little extra heat. And then lastly, I'm going to add 3 cups of packed spinach. And then we're just going to blend this up. I do have some water set aside so that if I need to thin the sauce out a little bit, I'll be able to do that. So I'll put the lid on. You can always make sure you're washing your hands before you start cooking, at least for 30 seconds with soap and water. And make sure all the vegetables that you used are well rinsed. So now we're going to go ahead and blend. So I'm just going to turn my blender on. Have some room temperature or slightly warm water that I'm just going to add a little bit to. I'm not going to add the whole half cup. I'm just going to add a little bit to start and see how the consistency is. So I'll just do a final spin after I push down this spinach. It's looking pretty and green. If you don't add the spinach, you really have a brown sauce. And which is fine too, but it adds a beautiful color and definitely adds a lot more fiber and vitamin A and other powerful nutrients. So I'm just going to go ahead and do it one more time. Okay. So now we're just going to go ahead and serve that. All right. So our zucchini noodles just cooked for about 3 minutes. If you cook them for too long, more than I'd say 4 or 5 minutes, they get kind of mushy, so keep the saute short. I do know people that add, when they add like a warm sauce, like a marinara sauce to their zucchini noodles, they don't even saute them because the warm sauce just warms it up. And then I'm gonna go ahead and I'm gonna pour some of my sauce over the top. This does make 4 servings, and for today I just did a couple. So, you know, definitely have 4 plates, and you can divide the zucchini noodles and the sauce evenly. If you have extra sauce, you can use it as a dip for vegetables or as a salad dressing. And then I always love to eat a rainbow of color. We know that different colors mean that there's different beneficial plant compounds in the vegetable. And all those different beneficial plant compounds have their own unique disease-fighting properties. So always try to include a little rainbow of color. I would say green onion or cilantro are my 2 favorite optional toppings to add. So either one is excellent. But if you don't have one of these ingredients, I really challenge you to leave it out and see how it goes. I've made this without the white beans. I've made it without the cilantro. So it's really versatile and flexible. Definitely you want the peanut butter though, don't skip that. You could also pour this sauce over steamed vegetables. So this is our zucchini noodles. I hope you all enjoyed our Whole Health Healthy Teaching Kitchen, and I can't wait to see you next time. In the meantime, enjoy every bite.
Important Medicare message. Scammers are using coronavirus to steal Medicare numbers, but you can protect yourself. If you get a call offering COVID-19 items and they ask for your Medicare number, hang up. Learn more at medicare.gov/fraud.
Medicare coverage and payment of virtual services. This video will provide you with answers to common questions about the Medicare telehealth services benefit. CMS is expanding this benefit on a temporary and emergency basis under the 1135 Waiver Authority, the Coronavirus Preparedness and Response Supplemental Appropriations Act, and the Coronavirus Aid, Relief, and Economic Security Act, CARES Act. Building on an unprecedented array of temporary regulatory waivers and new rules, CMS has issued another round of sweeping regulatory waivers and rule changes. These waivers and rule changes allow increased access to telehealth services for Medicare patients, so they can get care from their physicians and other clinicians while staying safely at home. CMS is expanding access to telehealth services for people with Medicare. This means they can receive care where they are, at home, or in a nursing or assisted living facility. If they have COVID-19, they can remain in isolation and prevent spreading the virus. If they aren't infected, they can get care without risking exposure to others who may be ill. CMS is exercising enforcement discretion to allow these services to be billed for both new and established patients. Medicare coinsurance and deductible would generally apply to these services. Patients must verbally consent to receive virtual check-in services. Certain services may be provided via audio-only telephones. CMS is also increasing payments for certain telephone visits to match payments for established patient office and outpatient visits. CMS is waiving limitations on the types of clinical practitioners that can furnish Medicare telehealth services. Let's begin with what are telehealth services? Telehealth, telemedicine, and related terms generally refer to the exchange of medical information from one site to another through electronic communication to improve a patient's health. During the pandemic, individuals can use commonly available interactive apps to visit with their clinician. While any technology with audio and video can be used, CMS is waiving the video requirement for certain counseling and education services and for the telephone evaluation and management services. How are services added to the telehealth services list? Until now, CMS only added new services to the list of Medicare services that may be furnished via telehealth using its rulemaking process. CMS is changing its process during the emergency and will add new telehealth services on a sub-regulatory basis, considering requests by practitioners now learning to use telehealth as broadly as possible. Who can provide telehealth services? All practitioners who may bill Medicare independently may provide telehealth services. Distant site practitioners who can furnish and get payment for covered telehealth services, subject to state law, can include physicians, nurse practitioners, physician assistants, nurse midwives, certified nurse anesthetists, clinical psychologists, clinical social workers, registered dietitians, nutrition professionals, physical therapists, occupational therapists, speech-language pathologists, and other practitioners. In addition, in many cases, CMS is allowing physicians to supervise their clinical staff using virtual technologies when appropriate, instead of requiring an in-person presence. What can Medicare pay for? Medicare can pay for office, hospital, and other visits furnished via telehealth across the country, and including in patients' places of residence. People with Medicare can receive care where they are, at home or in a nursing or assisted living facility. If they have COVID-19, they can remain in isolation and prevent spread of the virus. If they aren't infected, they can get care without risk of being exposed to others who may be ill. What services can a Medicare beneficiary receive through telehealth? Medicare beneficiaries will be able to receive a specific set of services through telehealth, including evaluation and management visits, common office visits, mental health counseling, and preventive health screenings. With the March 30th IFC, CMS will now allow for more than 80 additional services to be furnished via telehealth. Telehealth visits include emergency department visits, initial nursing facility and discharge visits, home visits and therapy services, which must be provided by a clinician that is allowed to provide telehealth. New as well as established patients now may stay at home and have a telehealth visit with their provider. Some of these services, including many behavioral health and patient education services and audio-only evaluation and management visits, will be available via audio-only telephones. During the public health emergency, individuals can use interactive apps with audio and video capabilities to visit with their clinician for an even broader range of services. These temporary changes will ensure that patients have access to physicians and other providers while remaining safely at home. CMS maintains a list of services that are normally furnished in person that may be furnished via Medicare telehealth. This list can be found at https://www.cms.gov/medicare/general-information/telehealth-codes. What requirements does telehealth fulfill? CMS is allowing telehealth to fulfill many face-to-face visit requirements for clinicians to see their patients in inpatient rehabilitation facilities, hospice, and home health. How does telehealth help with remote patient monitoring? CMS is making it clear that clinicians can provide remote physiologic monitoring services to patients with acute and chronic conditions, and can be provided for patients with only one disease. For example, remote monitoring can be used to monitor a patient's oxygen saturation levels using pulse oximetry. What about home health? Home health agencies can provide more services to beneficiaries using telehealth, as long as it's part of the patient's plan of care and does not replace needed in-person visits as ordered on the plan of care. If a physician determines that a Medicare beneficiary should not leave home because of a medical contraindication or due to suspected or confirmed COVID-19, and the beneficiary needs skilled services, he or she will be considered homebound and qualify for the Medicare home health benefit. As a result, the beneficiary can receive services at home. What about hospice care? Hospice providers can also provide services to a Medicare patient receiving routine home care through telehealth, if it is feasible and appropriate to do so. What about rural health clinics, RHCs, and federally qualified health centers, FQHCs? On March 27, 2020, the Coronavirus Aid, Relief, and Economic Security Act, CARES Act, was signed into law. Section 3704 of the CARES Act authorizes RHCs and FQHCs to furnish distant site telehealth services to Medicare beneficiaries during the COVID-19 public health emergency, PHE. What distant site telehealth services can RHCs and FQHCs provide? RHCs and FQHCs can furnish and bill any telehealth services that are approved as a distant site telehealth service under the Physician Fee Schedule, PFS, for the duration of the public health emergency, PHE. For more information about telehealth services furnished in RHCs and FQHCs and how to bill for those services, visit the MLN Matters article, SE 20016, New and Expanded Flexibilities for Rural Health Clinics, RHCs, and Federally Qualified Health Centers, FQHCs, during the COVID-19 public health emergency, PHE, on the CMS website at https://www.cms.gov/files/document/SE20016.pdf. Can nursing homes, home health agencies, or other healthcare facilities bill for telehealth services? Billing for Medicare telehealth services is limited to professionals. Like other professional services, critical access hospitals can report their telehealth services under CA Method 2. If a beneficiary is in a healthcare facility, even if the facility is not in a rural area or not in a health professional shortage area, and receives a service via telehealth, Medicare makes payment to the distant site practitioner for the professional services. For the service furnished via telehealth, the healthcare facility would only be eligible to bill for the originating site facility fee, which is reported under HCPCS code Q3014. Can hospitals bill for telehealth services? Hospitals may bill for services furnished remotely by hospital-based practitioners to Medicare patients registered as hospital outpatients, including when the patient is at home, when the home is serving as a temporary provider-based department of the hospital. Examples of such services include counseling and educational service, as well as therapy services. Can hospitals bill as the originating site? Hospitals may bill as the originating site for telehealth services furnished by hospital-based practitioners to Medicare patients registered as hospital outpatients, including when the patient is located at home. What are the types of virtual services? Even before the availability of this waiver authority, CMS made several related changes to improve access to virtual care. In 2019, Medicare started making payment for brief communications or virtual check-ins, which are short, patient-initiated communications with a healthcare practitioner. Medicare Part B separately pays clinicians for e-visits, which are non-face-to-face patient-initiated communications through an online patient portal. There are 4 main types of virtual services physicians and other professionals can provide to Medicare beneficiaries: Medicare telehealth visits, virtual check-ins, e-visits, and audio-only services. Let's take a look at each type of virtual service. Medicare telehealth visits. Currently, Medicare patients may use telecommunication technology for office, hospital visits, and other services that generally occur in person. For most services on the telehealth list, the provider must use an interactive audio and video telecommunication system that permits real-time communication between the distant site and the patient at home. However, CMS is waiving the video requirement for certain counseling and behavioral health services and telephone evaluation and management services. During the public health emergency, individuals can use interactive apps with audio and video capabilities to visit with their clinician for an even broader range of services. Additionally, the HHS Office of Inspector General, OIG, is providing flexibility for healthcare providers to reduce or waive cost sharing for a broad category of non-face-to-face services furnished through various modalities, including telehealth visits, virtual check-in services, e-visits, monthly remote care management, and monthly remote patient monitoring paid by federal healthcare programs. Here are some key takeaways about Medicare telehealth visits. Medicare will make a payment for Medicare telehealth services furnished to patients in broader circumstances. These visits are considered the same as in-person visits and are paid at the same rate as regular in-person visits. Medicare will make payment for professional services furnished to beneficiaries in all areas of the country in all settings. Any practitioner who can independently bill for Medicare services may be paid for Medicare telehealth services. For example, physical therapists, occupational therapists, and speech-language pathologists may bill for telehealth. Medicare will make payment for Medicare telehealth services furnished to beneficiaries in any healthcare facility and in their home. There is flexibility for healthcare providers to reduce or waive cost sharing for certain non-face-to-face services paid by federal healthcare programs. Virtual check-ins. In all areas, not just rural, established Medicare patients in their home may have a brief communication service with practitioners via a number of communication technology modalities, including synchronous discussion over a telephone or exchange of information through video or image. We expect that these virtual services will be initiated by the patient. However, practitioners may need to educate beneficiaries on the availability of the service prior to patient initiation. Virtual check-in services, or brief check-ins between a patient and their doctor by audio or video device, could previously only be offered to patients that had an established relationship with their doctor. Now, doctors can provide these services to both new and established patients. The patient must verbally consent to at least once a year to receive virtual check-in services. The Medicare coinsurance and deductible would generally apply to these services. The practitioner may respond to the patient's concern by telephone, audio-video, secure text messaging, email, or use of a patient portal. Standard Part B cost sharing applies to both. In addition, separate from these virtual check-in services, captured video or images can be sent to a physician. HCPCS code G2010. Key takeaways about virtual check-ins are: CMS is exercising enforcement discretion to allow these services to be billed for both new and established patients. Service is not limited to only rural settings or certain locations. Patient must agree to the virtual service. Use HCPCS code G2012 or HCPCS code G2010. Virtual check-ins can be conducted with a broader range of communication methods, unlike Medicare telehealth visits, which require audio and visual capabilities for real-time communication. E-visits. E-visits are non-face-to-face patient-initiated communications through an online patient portal. In all types of locations, including the patient's home, and in all areas, not just rural, established Medicare patients may have non-face-to-face patient-initiated communications with their doctors without going to the doctor's office by using online patient portals. The Medicare coinsurance and deductible will apply to these services. Codes for practitioners who may bill independently. Medicare Part B also pays for e-visits or patient-initiated online evaluation and management conducted via a patient portal. Practitioners who may independently bill Medicare for evaluation and management visits, for instance physicians and nurse practitioners, can bill the following codes: 99421, 99422, 99423. Codes for practitioners who may not bill independently. Clinicians who may not independently bill for evaluation and management visits, for example, physical therapists, occupational therapists, speech-language pathologists, clinical psychologists, can also provide these e-visits and bill the following codes: G2061, G2062, G2063. Key takeaways for e-visits include: this is not limited to only rural settings. There are no geographic or location restrictions for these visits. Patients communicate with their doctors without going to the doctor's office by using online patient portals. Individual services need to be initiated by the patient. However, practitioners may educate beneficiaries on the availability of the service prior to patient initiation. The services may be billed using CPT codes 99421 through 99423 and HCPCS codes G2061 through G2063 as applicable. The Medicare coinsurance and deductible would generally apply to these services. Audio-only evaluation and management, or assessment and management services. Audio-only services describe evaluation and management, E/M, or assessment and management services furnished by a physician or qualified healthcare professional via telephone or online. When can audio-only services be used? A practitioner can furnish audio-only visits to beneficiaries who do not have access to or choose not to use two-way audio-video technology. It is expected that these phone visits will be initiated by the patient. However, practitioners may need to educate beneficiaries on the availability of the service prior to patient initiation. Medicare coinsurance and deductible would generally apply to these services. Clinicians who may independently bill for evaluation and management visits can provide audio-only visits and bill the following codes: 99441, 99442, 99443. Clinicians who may not independently bill for evaluation and management visits can provide audio-only visits and bill the following codes: 98966, 98967, 98968. How will Medicare pay for audio-only services? Medicare will pay for the telephone evaluation and management visits to match payments for established patient office and outpatient visits. Key takeaways for audio-only services include: effective March 1, CMS began making payment for audio-only evaluation and management or assessment and management visits. The payments for the audio-only evaluation and management visits match the payments made for established patient office and outpatient visits. CMS is exercising enforcement discretion to allow the audio-only evaluation and management or assessment and management services to be billed for both new and established patients. There are no restrictions on where beneficiaries must be located to receive an audio-only evaluation and management or assessment and management service. Audio-only evaluation and management or assessment and management visits may be billed using CPT codes 99441 through 99443 or 98966 through 98968. The Medicare coinsurance and deductible would generally apply to these services. Are there any other professional services that Medicare covers? Medicare pays separately for other professional services that are commonly furnished remotely using telecommunications technology without restrictions that apply to Medicare Telehealth. These services, including physician interpretation of diagnostic tests, care management services, and virtual check-ins, are normally furnished through communication technology. How does a qualified provider bill for telehealth services? Medicare telehealth services are generally billed as if the service had been furnished in person. During the PHE for the COVID-19 pandemic, Medicare telehealth services claims should reflect the designated POS code for the location where the service would have occurred in person, and modifier 95 to indicate that the billed service was furnished as a professional telehealth service from a distant site. However, consistent with current rules for traditional telehealth services, there are 3 additional scenarios where modifiers are required on Medicare telehealth claims. In cases when a telehealth service is furnished via asynchronous, store and forward technology as part of a federal telemedicine demonstration project in Alaska and Hawaii, the GQ modifier is required. When a telehealth service is billed under COM Method 2, the GT modifier is required. Finally, when telehealth service is furnished for purposes of diagnosis and treatment of an acute stroke, the GO modifier is required. When billing claims for telehealth services with dates of service on or after March 1, 2020, and for the duration of the public health emergency, PHE bill, with the place of service, POS, equal to what it would have been in the absence of a PHE, along with a modifier 9.5, indicating that the service rendered was actually performed via telehealth. As a reminder, CMS is not requiring the CR modifier on telehealth services. How much does Medicare pay for telehealth services? Medicare pays the same amount for telehealth services as it would if the service were furnished in person. Should on-site visits conducted via video or through a window in the clinic suite be reported as telehealth services? Services should only be reported as telehealth services when the individual physician or professional providing the telehealth service is not at the same location as the beneficiary. That doesn't mean that service conducted via a video or through a window cannot be reported. The most up-to-date information on coronavirus waivers and flexibilities can be found in MLN Matters article SE 20011 at https://www.cms.gov/files/document/SE20011.pdf. This concludes our overview of Medicare coverage and payment of virtual services. This educational product was prepared as a service to the public and is not intended to grant rights or impose obligations. This educational product may contain references or links to statutes, regulations, or other policy materials. The information provided is only intended to be a general summary. It is not intended to take the place of either the written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. The Medicare Learning Network, MLN Connects, and MLN Matters are registered trademarks of the U.S. Department of Health and Human Services, HHS. Paid for by the Department of Health and Human Services.